By supporting the Flower Valley Conservation Trust, that's where we found goodness. Pick and Pay, always there for you.
Now, there is undoubted evidence of a significant increase in the number of people who have asthma among all races in South Africa. Over the past 25 years, a 25 to 200 times rise in hospital admissions for asthma has been recorded in hospital. Our Pick and Pay pharmacist, Fransa Katz, is here to shed some light on this issue and, of course, to tell us what we need to be looking out for as well. Good morning. How are you, Fransa?
Well, thank you.
Now, tell us, for those of us who are not familiar or who don't know too much about it, what is asthma and can it be life-threatening?
Asthma can be defined as when you're, let me put it this way, short of breath, wheezing, coughing, and what causes it is that there's an inflammation of the bronchial tubes in the lungs, and the inflammation then causes narrowing, so the patient can't breathe properly because of that inflammation and the narrowing, and also the muscles around the bronchial tubes can constrict, and we talk about bronchospasm. So you would find that the patient would really battle to breathe, especially breathing out, getting enough air out of the lungs to breathe in again. And if it's not treated, and especially if it's an acute attack and it's not treated immediately, the patient can actually end up dying, because they can't get in any air.
Now, you mentioned struggling to breathe, which would be a massive indicator of something or that there's a problem in your body. But for anybody who's sitting right now and watching, what are some of the symptoms that they should be looking out for to indicate that there's a problem and I need to look at it?
One of the things is when you feel that you can't breathe properly, your chest feels very tight. Not always, but in most cases, you would find that an asthma patient would wheeze when they breathe out. You'd hear those noises, which is also phlegm that is sitting in the bronchial tubes. And that wheezing is one type of thing to look at. But definitely, if you find that you're battling to breathe, maybe on more than one day, please go see your doctor, because it could be that you starting with an asthma attack, which you've maybe never had before, because it can start at any age.
Okay, and what are some of the things that can trigger an asthma attack?
It's normally an allergen, something that you breathe in that the lungs find irritating, and because of that irritation, the response is the inflammation. And that causes the narrowing of the tubes. But usually allergens, it can also be emotion. If you're very angry or laugh a lot, or fear can also cause a trigger and start the asthma attack.
Let's look at some of the interesting facts surrounding asthma. 95% of children with persistent asthma still have symptoms into adulthood. Also, 60% continue to have persistent asthma, characterized by, some of these acute respiratory issues as well. Now, what are, can we still be doing exercise and can we still be active?
Interesting enough that you find some people might not have asthma during the day, but they get, as we call it, exercise-induced asthma. Usually that is because of the cold air. You go run in the morning and the lungs get hit with this cold air, and then it has a response again of causing an asthma attack. But asthma is something that cannot be cured, but it can be controlled. And it's very important that patients understand there are two types of medications that are used. You get your long-term medication, and usually it's used in an aerosol inhaler, because that goes straight to the lungs. So tablets can also be used, but this is a better method, and you would use your cortisone type of inhaler to prevent asthma attacks by keeping the inflammation down. And then you get an inhaler that is for an acute attack, which you should carry with you all the time. Very important. Asthma sufferers must carry it with them. Because when you use that for an acute attack, it just opens the chest immediately. But it's not, you can look after it if you use both. you can't just carry on with the symptoms and just use the inhaler when you have an acute attack. It needs to be managed.
Yeah. Wow, thank you so much for that, Fransa. It's good to know that if you are suffering from asthma, you can still continue to have a regular life. You can play sports.
Can play sport,
you know?
because if you're on a program which you need to discuss with your doctor, that will cause you to use the medication the right way, so that there are many athletes, many athletes that are asthma sufferers, but because they are using their medication correctly, they can continue with their sport.
Yeah, wonderful. Thank you so much, Fransa. Thank you for being here. Thank you for shedding light on the situation. It's definitely not something that you need to be afraid of, so that's very good to know. You can lead a very normal, happy, regular life if you are suffering from asthma. All you need to have is, have the correct tools, and of course, education is everything. So thank you so much, Fransa, for being here with us. You can follow Fransa on Twitter as well.
Yes.
Hey, wonderful. What is your Twitter handle?
It's Fransa Katz. K-A-T.
There we go. At Fransa Katz. Follow her on Twitter. You can ask her all the questions your heart desires. We'll be right back after this break.